today's topic is eicosanoids. Okay. What are those eicosanoids? They are 20 carbon compounds derived from arachidonic acid. Arachidonic acid, it is 5, 8, 11, 14 eicosanoic acid. Okay. 5, 8, 11, 14 eicosanoic acid. It is the arachidonic acid, and eicosanoids derived from this 20 carbon arachidonic acid. Okay. Now, what are the important eicosanoids? They are prostanoids. In this prostanoids group, there is prostaglandin, denoted as PG, prostacyclin, PGI, and thromboxanes, TX. And another is leukotrienes. So, important eicosanoids are prostanoids and leukotrienes. Within these prostanoids, there is prostaglandins, prostacyclins, and thromboxanes. Now, some characteristics of eicosanoids. They are autocoids. Autocoids means they act on the cell close to their site of production. Means in which site they are produced, that action site is very close to that. So, they are autocoids. And it is the difference between these hormones and autocoids or eicosanoids. They also act like hormone, but hormone acts distal site, but this eicosanoids acts locally, very close to their site of origin. They are rapidly degraded. Within minutes or hours, they are degraded, and they have both intercellular signaling and intracellular signaling cascades. This signaling cascades means chain of reaction. Okay. So, they have both intercellular, means within the cell, intracellular, between the cells, signal cascades, means whenever a eicosanoids bound to the receptors, specific receptors, there is chain of reaction. Okay. So, they have both intercellular signaling and intracellular signal cascades. Next, these prostaglandins inactivated by 15-hydroxy prostaglandin dehydrogenase. Okay, dehydrogenase, there is reduction reaction. It involves in oxidation reduction reaction. Okay, this prostaglandins inactivated by 15-hydroxy prostaglandin dehydrogenase enzyme, which converts this 15-hydroxyl group, OH group, hydroxyl group, to keto group, and thus inactivated this prostaglandin. Okay. Next, the synthesis of eicosanoids. It is synthesized from membrane-bound phospholipids, and by phospholipase A2 enzyme, it converted to arachidonic acid. Okay. First, membrane-bound phospholipid by phospholipase A2 converted to arachidonic acid. This step is inhibited by corticosteroids or cortisol. This step is inhibited by corticosteroids or cortisol. Okay. In the next step, this arachidonic acid, there is two pathways, one for leukotrienes and another for prostaglandins. In this leukotrienes pathway, by 5-lipoxygenase, arachidonic acid converted to 5-hydroperoxy icosanoic acid. Okay. In the leukotriene pathway, by 5-lipoxygenase enzyme, arachidonic acid converted to 5-hydroperoxy tetraenoic acid, and the cyclooxygenase enzyme, this COX means cyclooxygenase, cyclooxygenase, okay. Cyclooxygenase, short form is COX. There are two enzymes, COX-1 and COX-2. By this cyclooxygenase, arachidonic acid converted to PGD2, prostaglandin G2. And this step is inhibited by aspirin, indomethacin, phenylbutazone, NSAID, means analgesics. All analgesics are usually NSAID. Aspirin, indomethacin, phenylbutazone and NSAID. They inhibit this cyclooxygenase enzyme. Both the cyclooxygenases means COX-1 and COX-2. And another is COX-2 specific, selective COX-2 inhibitor, it is celecoxib. So, acts only on COX-2 enzyme, no effect on COX-1, okay, selective COX-2 inhibitor. So, in this cyclooxygenase pathway, prostaglandin is synthesized. First is from arachidonic acid to PGD2. In the leukotrienes pathway, this 5-hydroperoxy icosanoic acid converted to leukotriene A4. So, the first leukotriene is formed is leukotriene A4. From that, leukotriene B4. It is in the polymorphonuclear lymphocytes, found in polymorphonuclear lymphocytes. By glutathione, it is a amino acids, 3 amino acids are there in the glutathione, okay, and this leukotriene A4 with the help of glutathione converted to leukotriene C4, and this leukotriene C4 release the glutamate, GLU for glutamate, release this glutamate amino acid and convert it to leukotriene D4. This leukotriene D4 again release the glycine amino acid and convert it to leukotriene E4. There are 3 amino acids within this glutathione. One is glutamate, cysteine and glycine. By glutamate, leukotriene A4 converted to leukotriene C4. Releasing glutamate, it converts to leukotriene D4. Releasing glycine, it converts to leukotriene E4. And another pathway, there is conversion of lipoxins, lipoxin A4 by this leukotriene A4. So, leukotriene A4, there are 3 types of conversion. One is leukotriene B4, another is by leukotriene C4, it converts to leukotriene D4 and E4, and another lipoxins, okay, lipoxin A4. Next, this PGD2, which is produced by the cyclooxygenase enzyme from the arachidonic acid by peroxidase enzyme converted to PGH2, okay, PGG2 by peroxidase enzyme converted to PGH2. this PGH2 by different enzymes converted to different type of prostaglandins, prostacyclin and thromboxanes, means prostanoids. What are those? By thromboxane synthase, it converted to thromboxane A2. By prostacyclin synthase, synthase means synthesis kore, okay. So by prostacyclin synthase converted to prostacyclin, by isomerase converted to PGD2, and again by isomerase converted to PGE2, and this PGE2 by reductase converted to PGF2 alpha, okay. These are the prostanoids derived from PGG2, which is derived from arachidonic acid by the action of cyclooxygenase enzyme. Firstly, by peroxidase it converts to PGH2, then by thromboxane synthase converted to thromboxane A2, by prostacyclin synthase it converts to prostacyclin PGI2, by isomerase it converts into PGD2 and PGE2, and by reductase the PGE2 converted to PGF2 alpha. Next, the functions of prostaglandins and leukotrienes, or the function of eicosanoids, okay. What are the functions? They regulate inflammation. Which prostaglandins helps in inflammation? PGD2 and PGE2. They produce vasodilation by PGI2, vasoconstriction by thromboxane A2, okay. They produce platelet aggregation by thromboxane A2 and platelet disaggregation by prostacyclin PGI2. They induce labor and produce uterine muscle contraction. That means in case of uterine contractions, means during delivery, if there is delay or if there is such condition is developed, there is need of induction of labor. So then what prostaglandins are used? This PGE2 and PGF2 alpha, okay. So they regulate inflammation by PGD2, PGE2. They vasodilation by prostacyclin PGI2, vasoconstriction by thromboxane A2, platelet aggregation by thromboxane A2, platelet disaggregation by prostacyclin. Just second and the third point is just opposite, okay. First it is by vasodilation by prostacyclin, platelet aggregation by thromboxane A2, vasoconstriction by thromboxane A2, platelet disaggregation by prostacyclin PGI2, okay. Induction of labor or uterine muscle contraction by PGE2, PGF2 alpha. Next, bronchodilation in inhaler asthma patient, prostaglandins are used, that is PGE. Bronchoconstriction, the opposite effect, bronchodilation by PGE, bronchoconstriction by leukotrienes, mainly leukotrienes C4, D4, E4 and PGF. This bronchoconstriction in case of acute asthma, slow reacting substance of anaphylaxis is produced by these leukotrienes. So In case of asthma, the main cause is this leukotrienes, which produce bronchoconstriction by PG leukotrienes C4, D4, E4, another is PGF. Okay. Acts on parietal cells in the stomach, parietal cells in the stomach wall to inhibit acid secretion. They inhibit acid secretion, prostaglandins. Lipoxins, LXA4, these are anti-inflammatory and decrease the immune response. Okay? Lipoxins are anti-inflammatory and reduce the immune response, and they use in maintenance of intraocular pressure. In case of glaucoma, there is rise of intraocular pressure, which is decreased by this PGF2 alpha analogues. PGF2 alpha analogues. And so it is used as medicine for this glaucoma patient to reduce the intraocular pressure. What is this compound? PGF2 alpha analog. Now, synthetic prostaglandins. What are the synthetic prostaglandins? Means it is not produced within the body, but we synthesize it. What are those? PGE1 analog. It is misoprostol. PGE2 analog. It is dinoprostol. And PGF2 analog. It is dinoprost. Okay. PGE1 analog. It is misoprostol. PGE2 analog. It is dinoprostol. And PGF2 analog. It is dinoprost. What are the function of these three prostaglandins? Induce labor or abortion. Okay? They induce labor or abortion. Another is PGF2 alpha analog, which is latanoprost. PGF2 alpha analog, which is latanoprost. It is used in glaucoma to decrease the intraocular pressure. Okay? These four are synthetic prostaglandins. Now, mechanism of action of prostaglandins. How prostaglandin acts within our body. They act like local hormones. That means their site of origin and the site of action is very close to each other. ATP by adenylyl cyclase converted to cyclic AMP, and this cyclic AMP produce different biological effect. Okay? ATP by adenylyl cyclase produce cyclic AMP, and this cyclic AMP produce biological effect. Now, PGE increase cyclic AMP in most of the tissues. So, they increase the biological effect, it may be different type of biological effect. So, PGE increase cyclic AMP in most of the tissues, but in adipose tissues and in renal tubular cells. Adipose tissue means fat tissue, and renal tubular cells means within the kidney, renal tubules. Okay, cells within the renal tubules. There PGE decrease this cyclic AMP. So, the action is, biological effect is reduced in case of adipose tissue and in renal tubular cells. The prostacyclin activates adenylyl cyclase, that means increase cyclic AMP, enhance the biological effect. Thromboxane A2 inhibits adenylyl cyclase, that means decrease cyclic AMP and decrease the effects. Okay? Mechanism of action of aspirin. Aspirin is cyclooxygenase enzyme inhibitor. Okay. So, how they act? They act as they acetylates. Acetylates means at the acetyl group. Acetylates irreversibly and inhibit cyclooxygenase. They inhibit cyclooxygenase, but how? By acetylation of the enzyme, and thus inhibit it irreversibly. Means once time it inhibits the enzyme, it cannot regenerate. So, aspirin acetylates irreversibly and inhibits cyclooxygenase. So, platelet cannot regenerate cyclooxygenase. So, within the platelet cannot regenerate cyclooxygenase as it is inhibited by this aspirin, and it is irreversible process. So, thromboxane A2 is not formed. If the enzyme cyclooxygenase is inhibited, then the prostaglandins, thromboxanes, prostacyclins all will be reduced because there is no synthesis of these thromboxanes also. Okay. Remember this chart of synthesis. Okay. If this cyclooxygenase is inhibited by aspirin, cyclooxygenase 1 and 2, both the enzymes are inhibited irreversibly. There is no production of PGD2. Next, no production of thromboxanes, prostacyclins, other prostaglandins. Okay. So, thromboxane A2 is not formed in platelets. Hence, there is decreased platelet aggregation. Thromboxane A2 in the function slide you show that what are the functions? Platelet aggregation by thromboxane A2 and disaggregation by prostacyclin, vasodilation by prostacyclin, vasoconstriction by thromboxane A2. Okay. So, if thromboxane A2 is not synthesized, so there is no platelet aggregation. Okay. If it is not synthesized, there is no platelet aggregation. Hence, there is decreased platelet aggregation, and therefore, aspirin is useful in prevention of heart attack. In heart attack, what happens? There is coagulum formation within the blood vessels, or blood vessels is blocked by coagulum or platelet aggregation. So, if we give those patients aspirin, aspirin will irreversibly inhibit the enzyme cyclooxygenase, which inhibit the thromboxane A2 synthesis. So, there will be no platelet aggregations, means the condition of heart attack will be improved. Understand everybody? Okay. So, thus, therefore, aspirin is useful in prevention of heart attack. So, if a patient comes with chest pain and you found that property is positive or patient have heart attack, you should advise aspirin as soon as possible. This aspirin will act how? It will inhibit the cyclooxygenase irreversibly and thus inhibit the production of thromboxane A2 and thus prevent the platelet aggregation. Okay. By inhibiting cyclooxygenase, aspirin also inhibit prostacyclin because same synthesis pathway. So, PGI2 is also inhibited, but endothelial cells after a few hours will resynthesize cyclooxygenase. Platelet cannot resynthesize, but the endothelial cells can resynthesize this cyclooxygenase enzyme. So, aspirin completely blocks thromboxane A2, but only partially inhibit prostacyclin because this prostacyclin again produced by these endothelial cells which produce the cyclooxygenase enzyme, these will produce prostacyclin. But platelet cannot resynthesize this cyclooxygenase enzyme, so it completely blocks the thromboxane A2. Okay. This is the mechanism of action of aspirin. It is very important, and in this Eicosanoids chapter, if one question comes in theory, it will be it. It is mechanism of action of aspirin. Okay. Other inflammatory drugs, what are those? Indomethacin, phenylbutazone, NSAIDs, ibuprofen. They also cause irreversible inhibition of this enzyme. Enzyme what? Cyclooxygenase. Okay. Paracetamol is a reversible inhibitor. Reversible inhibitor of what? Cyclooxygenase enzyme. Okay. Now next, mechanism of action of steroids. How steroids acts? Steroids binds to intracellular receptors, which then move to the nucleus and alter the gene transcription. Means this is the cell and within it, it is the nucleus. Steroids binds with the receptor and goes intracellularly and go to the nucleus. And alter the gene transcription. Okay. Alter gene transcription. Within the nucleus there is DNA and gene transcription is within the nucleus. So steroid binds to the intracellular receptors and which then move to nucleus and alter the gene transcription. And this process leads to the inhibition of genes that are involved in inflammation. Inflammation also have its own genes. Gene transcription is there. So steroid, how it is acts? It binds to the intracellular receptors and move to the nucleus and alter the gene transcription, and this process leads to inhibition of genes that are involved in inflammation, and this way steroids acts in inflammation. Okay. If you have any doubt, you can ask. What are those eicosanoids? They are 20 carbon compound derived from arachidonic acid. What are the eicosanoids? Prostanoids, prostaglandin, prostacyclin, thromboxane, and leukotrienes. What are the characteristics? They are autocoids, acts locally, very close to their site of origin, degraded rapidly. They have both intercellular and intracellular signal cascades. They are inactivated by 15-hydroxyprostaglandin dehydrogenase, which converts the 15-hydroxyl group to keto group. Synthesis from membrane-bound phospholipid by this phospholipase A2 converted to arachidonic acid. This step is inhibited by corticosteroids. Okay. This step is inhibited by corticosteroids or cortisol. So you can ask what are the inhibitors of prostaglandin synthesis in different stages. Phospholipase A2 is inhibited by corticosteroids. Cyclooxygenase is inhibited by aspirin, indomethacin, phenylbutazone, and NSAIDs. They inhibit both the enzyme COX-1 and COX-2. Selective COX-2 inhibitor is celecoxib, used in orthopedic pain like rheumatoid arthritis, okay, severe pain, and this type of medicines are used, celecoxib. Then leukotriene pathway by lipoxygenase, it converts to 5-hydroperoxy eicosatetraenoic acid. Tetraenoic means 4 double bond, okay, and by cyclooxygenase PGD2. Then in leukotriene pathway, 5-hydroperoxy icosahexaenoic acid converted to leukotriene A4, which converted to leukotriene B4, C4 and lipoxins. Leukotriene C4 by releasing glutamate converted to leukotriene D4, which by removing glycine converted to leukotriene E4. In prostaglandin synthesis pathway, PGD2 by peroxidase enzyme PGH2, thromboxane synthase forms thromboxane A2, prostacyclin synthase from PGI2, isomerase from PGD2, PGE2, reductase from PGF2 alpha. What are the functions of prostaglandins? You have to write these 8 or 9. These are the most important functions, and you can see it used in day-to-day life in patient care service. Okay, they regulate inflammation. They have vasodilation effect by PGI2, vasoconstriction effect by thromboxane A2, platelet aggregation by thromboxanes, platelet disaggregation by prostacyclins, induced labor by PGE2 F2 alpha, bronchodilation by PGE, bronchoconstriction, which is the cause of asthma, leukotriene C4, D4, E4 and PGF, acts on parietal cells of the stomach to inhibit the acid secretion. Prostaglandins, lipoxins are used as anti-inflammatory, decrease immune response and maintains the intraocular pressure in case of glaucoma. What are the synthetic prostaglandins? There are 4 prostaglandins which are synthesized outside, that is misoprostol, dinoprost and latanoprost. Mechanism of action of prostaglandin, okay, they either induce this adenylyl cyclase or decrease the adenylyl cyclase. Okay, PGE increase the cyclic AMP by in most of the tissues except adipose tissue and renal tubular cells. PGI activates adenylyl cyclase, thromboxane inhibit adenylyl cyclase. And the most important is mechanism of action of aspirin. It irreversibly inhibits the cyclooxygenase enzyme by acetylation of the enzyme. So thromboxane A2 cannot resynthesize, so there is no platelet aggregation, and thus it prevents the heart attack. It also inhibits prostacyclins, burst endothelial cells. After few hours will resynthesize this cyclooxygenase. So aspirin completely blocks thromboxane A2 but only partially inhibits thromboxane PGI2. And other inflammatory drug, they also irreversibly inhibit this enzyme. Paracetamol is a reversible inhibitor, and the steroids act intracellularly, bind to the nucleus, go to nucleus and inhibit the gene transcription and thus alter the inflammatory process. Okay? Any doubt? These are the questions of these eicosanoids. Okay? Thank you.